Hello, I'm Kathleen. I'm a paediatric nurse and also a sleep expert. I'm here to talk about avoiding some of the sleep issues that may arise in children and babies over the age of 3 months when they have cold and flu. One thing's very important is to make sure that your child gets lots of adequate fluids. Cold fluids, diluted fruit juices. If they're over a year old, possibly lemon and honey type drinks. Make sure that they stay well hydrated. If they develop a fever, it's important to manage that fever, but also to make sure that they're in cotton clothing and they have loose-fitting clothing so they don't overheat, and make sure that their bedroom is well ventilated. Little noses and airways can get blocked, and that will prevent your child from sleeping well. So try placing a few drops of natural infant decongestant, either on a hanky under a pillow if your child has one, or pop it onto the blanket or onto the bed sheet, somewhere in the bedding, where the menthol and the natural oils of eucalyptus and menthol can actually help to alleviate any blockage and help your child to breathe much better. We all know that it's quite common when you lie flat that sometimes when you're a bit blocked up it's more difficult to breathe. So I would suggest that you might want to elevate the head of your baby's bed by maybe popping a folded sheet or a pillow or something underneath the mattress at the head end, which makes it a little easier for your baby to breathe. We all know that young children hate trying to blow their nose, and under the age of 2 they find it absolutely impossible. It's a very good idea to make it a bit of a game, and it's a good idea to encourage them to think of blowing their nose as sniffing, but in reverse. If it's turned into a game, they'll surely take to it and you won't have any problems in the future. Colds and flu should sort themselves out. We all have them all the time. But if you notice that your child isn't improving or the symptoms are getting in any way worse, do please consult your doctor. If you want information about other things that you might want to purchase for other flu symptoms such as fever, etc., why not have a word with your pharmacist who can advise on over-the-counter medicines and remedies that you can buy for children of all ages.